Good evening. The parents of another child who died after heart surgery at Bristol Children's Hospital are calling for a public inquiry. A report into the treatment of 4-year-old Sean Turner highlights staff shortages and poor recognition of his worsening state. Our health correspondent Matthew Hill reports.
Sean Turner was born with a serious heart condition. He had an operation at the Children's Hospital in March, but his parents say their living nightmare really began when he was discharged to Ward 32 from intensive care, or PICU, only one day afterwards.
Sean was losing masses of fluid, up to 3 litres a day. He was getting chronically dehydrated.
We begged to go back to PICU. I think in the 4 days we saw one consultant who said that he'd had major heart surgery and this was to be expected.
Said he looked fine to him.
Yeah.
He wasn't concerned.
And then on the Thursday, as they were preparing to look at Sean, because they had a meeting to go to, and they would look at him after the meeting, Sean had a cardiac arrest in my arms.
Sean was then admitted to intensive care, but 4 weeks later, he died of a massive bleed in his brain. A hospital review into his death highlights suboptimal nursing staff on the ward, a failure to recognise his deteriorating condition, and poor communication with his parents. Later, when they complained, Sean's parents say a senior member of staff admitted families had been given the wrong impression about the level of care. The hospitals say Sean Turner was a seriously ill child with an unusually complex heart disease. They say the clinical team did their best for him on an hour-by-hour basis as his condition changed. They say a review of his care has identified where it could have been improved, and they've apologised to his parents for any shortcomings.
When patients are discharged from the paediatric intensive care unit, we have an outreach service, which is a nursing team, a specialised nursing team, that help provide care for those patients for the first 48 hours of their care on Ward 32.
The coroner has now been persuaded to have an inquest. Sean's parents hope that will give them some answers. Matthew Hill, BBC Points West.
Well, this week we've had a number of reports about the care at Bristol Children's Hospital over the last 9 months. First, there was Luke Jenkins, whose death was partly due to staff shortages. Then on Wednesday, more cases came to light. We told you about 3-year-old Jack Casey and 9-week-old Oscar Wilcox, whose parents both said they were found lying in their own vomit. Well, earlier I asked Matthew Hill if these were isolated incidents or was there a pattern.
These concerns were raised 2 years ago in relation to a near miss where staff shortages were raised. Then, particularly this year, we've had the problem with these 2 deaths. We've got 6 other concerns about serious incidents on this ward. And it's all about concerns about staffing levels and patients being pushed out of intensive care when they're really ready. But the hospital stress they do have ways of managing this, and they're on top of it.
We must remember we're dealing with very ill children in some cases, aren't we? But Bristol has been chosen as a specialist centre for heart surgery. Is it still one of the best places in the country?
Well, the latest data, which is 2 years old now, shows it's the 3rd best in terms of the results, survival after 30 days of an operation. These problems are primarily post-operative care, and they're very conscious of the need to have a high dependency unit where you have 1 nurse to 2 patients. They don't have that at the moment. And they're trying to bring that forward. They will have it eventually when it becomes one of 7 centres, but they are trying to bring that forward.
Our health correspondent Matthew Hill. Detectives investigate